Hello everyone, Mo, Anne, Emily, and Carly are here today to present to you questions 17 to 20 on newborn complications. So, our first question is the pediatrician orders ampicillin and gentamicin IV until blood cultures come back with the proper results. Why would he choose these antibiotics to begin with? So we know ampicillin is gram-positive with some gram-negative and can be used for the treatment of respiratory infections alongside meningitis and sepsis, while gentamicin is gram-negative. So they're both used well together in conjunction to resolve bacterial infections. So it's also important to note that using both gram-negative and gram-positive antibiotics allow treatment to commence before the exact infective agent is known, and this gives a broad spectrum of antibiotic coverage to treat the bacterial infection. So newborns that are exposed to bacteria such as GBS via the birth canal are also at a higher risk for developing infections such as sepsis. Therefore, it's important to treat it fast. Okay, moving along to question 18. Complete the medication calculations to ensure the newborn is getting the proper dose. Please show your work. So first we're going to look at our ampicillin, so 150 milligrams per kilogram for 24 hours, Q6H IV. So we're going to ensure our orders are in an acceptable range per our drug guide, to review our drug monograph and any additional information required to administer IV medication. Next, we're going to convert our weight from grams to kilograms. So we're going to have our 3,157 grams divided by 1,000 results in 3.157 kilograms. Next, we're going to input the weight into our formula provided us. So it's going to be 150 milligrams times 3.157 kilograms equals 474 milligrams per 24 hours. And then we're going to calculate the number of doses in 24 hours. So this will be done by taking our 24 hours divided by Q6H, results in 4 doses total over 24 hours. And then lastly, we're going to calculate our dose that we're going to give to the baby. So we're going to have 474 milligrams divided by 4 doses yields 119 milligrams over a dose. So moving along to our next question here. We're talking about gentamicin. So our formula is known to be 25 milligrams a kilogram for 24 hours, and this is Q8H IV. Both meds are IV. So first we're going to check our orders again in reference with our drug guide, any monographs, any other resources that are pertinent to administering IV medications. And then next we're going to convert our weight from grams to kilograms once again. So this is 3,157 grams divided by 1,000 results in 3.157 kilograms. And then we're going to input our weight into our formula. We're going to do so by 25 milligrams times 3.157 kilograms, results in 79 milligrams per 24 hours. And then we are going to calculate our number of doses within our time frame of 24 hours. So we're going to have our 24 hours divided by our Q8H, and this yields 3 doses per 24 hours. And then lastly, we're going to calculate our dose that we're going to be given to the baby. So it's milligrams per dose. So 79 milligrams divided by 3 doses equals 26 milligrams a dose. Okie doke, moving along to question 19. So what needs to be done before a 4th dose of gentamicin and why? So we're going to get some lovely blood work done. So this needs to be completed to assess the trough level of our gentamicin in order to determine our next dose of the medication if it is indicated as appropriate treatment. And then following up, we will need to review the results of the blood cultures to determine the appropriate target therapeutic antibiotic for this suspected infection. Ensuring an appropriate trough level for our antibiotics is pertinent, especially in pediatrics and neonatals, provided that they're at a higher risk of medication toxicity in their body. It's also important to note that newborns exposed to bacteria such as GBS via the birth canal are at a higher risk of developing an infection that leads to sepsis. Therefore, prophylactic antibiotic treatment is necessary. So moving along to question 20, our last question. At this point, the newborn is still exhibiting symptoms of increasing respiratory distress, and you worry that he will require further respiratory support soon. So what would be your next nursing steps? So our first nursing step would be to perform a rapid assessment, then perform a focused respiratory assessment and vital signs, call the respiratory therapist and physician, with our findings, and then reposition the newborn to improve breathing. Continuous pulse oximetry monitoring SATs that go below 95. And then we're going to assess the baby closely to see if he needs to be transferred to a higher level of acuity care. And also transferring the baby from the mom to the warming station or table to intervene and provide care appropriately. And then also administer positive pressure ventilation as indicated. Additional nursing interventions include continuous monitoring of accurate ins and outs to ensure that one is not going into fluid overload. And at this point, we can conclude our care for Body and her newborn son. Thank you all for listening to our presentation.